Welcome to Beyond Intervening, Measuring Bystander Intervention, a conversation with Rose Hennessy.
This is part of the National Sexual Violence Resource Center's Research to Practice initiative, where we bring together researchers, preventionists, and advocates to explore current topics of research and the ways we can be implementing and exploring that research within our everyday work with one another. I am Taylor Teichman, Project Coordinator with the National Sexual Violence Resource Center, and I am joined today by my colleague Sally Lasky and our very special guest, Rose Hennessy. So before we dive into our conversation, I'd like to hand it over for just some brief introductions. So Sally, would you mind just introducing yourself quickly, and then we'll have Rose introduce herself as well.
Thank you, Taylor. I would love to. It's great to be here with you and Rose today. My name is Sally Lasky, and I'm the Evaluation Coordinator at the National Sexual Violence Resource Center.
Thank you, Sally. And Rose, we are so excited that you're joining us today. Would you mind just introducing yourself?
Yeah, absolutely. It's a pleasure to be here this morning or whenever people are listening. I am a PhD candidate at the University of Wisconsin-Milwaukee, the Joseph Silver School of Public Health. That's here in Wisconsin. And in addition to trying to finish up school, I also teach courses at the undergraduate and graduate level in public health and social work. And I've got about a decade of experience working in the sexual violence field, primarily from the prevention and evaluation end. So doing some direct practice, working at the coalition level, and in more recent years, evaluating programs.
Measurement of bystander intervention is a continuous challenge. What are some best practices in measuring bystander outcomes to overcome common challenges?
So that's a great question. And when we think about that from an implementation standpoint, like I'm actually on my campus implementing a program or maybe working with one evaluator or researcher to do it, I wanted to bring up 3 challenges that I have seen and 3 recommended suggestions. So the first being, and everyone knows this, that having positive intentions or attitudes to do something is much different than actually doing them. And we have a whole research literature to show that. Like, I plan on exercising and eating healthy, but then the reality is that life is hard and there are challenges, and I don't always end up doing that. So how do you implement a program and then you're like, I want to measure change in behavior because I know that intentions are correlated, but they're not the same. But my students and the participants are right here, so I give them a post-test. Well, I can't ask them, have they increased their behaviors on their post-test because they have had 12 seconds to do so, and they need more time. So most practitioners are asking about intentions and attitudes. Now, there's nothing wrong with that. It is a limitation, so either reporting those findings in the context of intentions are a great predictor for behaviors is great. I would like to argue that I think that nowadays we could do better, especially on college campuses or in schools, because a lot of these programs are becoming mandated, so we know the exact students who are in the trainings. A lot of these are required online programs, and we have their email address. And I wonder what it would look like to reallocate resources and to also this would be like a upward and downward conversation, reallocate funding priorities as well to say, what if instead of giving out those post-tests, which we then have to compile or we have to create the link and we have to edit, we wait 3 to 6 months? Because the students, most of these programs are in fall. They're going to be here through at least December, probably through spring for many of them. We send them a follow-up link because we already have their email, and we ask them to actually fill out a follow-up survey to measure behaviors. Now, we're going to have a lower response rate, and we know that, but we could maybe change the way we're looking at things because we want to know the actual experiences and behaviors of people on our campus or in the communities where we're doing this. So that's just like one suggestion that, if we have access to these populations, could we consider reallocating our resources and moving beyond, was the training helpful? Did you like it? Did it change the way you think? to what experiences, even if it's open-ended, have you had since this training, and what have you done 3 to 6 months later, or even a few years later. And then, we don't have a lot of money or resources in our field, but occasionally we get something like, people like to go to football games and those tickets can be expensive, or maybe there's an iPad or something where you're raffling it off. If you fill out this follow-up survey, we're going to raffle off an iPad to one of the first 100 people who do it. Is there an opportunity to move beyond? Second issue I want to talk about goes back to that always intervening versus sometimes intervening. It's not currently published, but there is emerging research that I think will be published soon, and most researchers are going to a ratio score of intervening. So instead of asking, do you intervene yes or no, asking about a number of scenarios, like here are 10 scenarios, how many of them did you witness? Of those that you witnessed, how many did you intervene? So if I ask you about 10 scenarios and you say you witnessed 3 of them, that would be my 3 in my model, but you only intervened in 1, I would say that your intervention score is 1/3 or 0.33. So that you intervene 33% of the time versus 100% of the time versus 14 or 0. So this is becoming kind of a best practice that I think practitioners can start to implement as well when they talk about changes in behaviors, that we have to consider what people witness and then whether they intervene or not. In that, someone who has a score then of 100% but only saw one thing versus someone who has a score of 50% but they witnessed 500 things, there's the limitation to this measurement moving forward, but we think it's a step in the right direction. And then last but not least, I have this big question mark, and I'm having this stand because it says reality and actuality, that something that's emerging in my research and data set is that we're having some misclassification issues, meaning that when we use closed-ended categories for measurement, so this scenario happened, what did you do? This is common, right? I did nothing, I went and got help, I tried to separate them, I created a distraction, I physically intervened. So these are like common kind of categories that people might use. So we did a study where we asked these things, but then we went further and said, can you explain what you mean when you said you physically intervened? And students are starting to write things like, I would tell them to stop. Well, telling someone to stop is not physically intervening. That's a verbal strategy. That would be a direct strategy. And a lot of the time, these things are co-occurring, or sometimes there's 3 or 4 different strategies. I created a distraction, I separated someone, then I went to get help. When we only give people single categories, are we getting anywhere near the reality of their scenario? So a suggestion for that is to consider more open-ended and qualitative approaches to allow people to check more than one option. What did you do in this scenario? Check all that apply. That's like the easy low-hanging fruit option. And then, even because we're looking at reality and actuality, maybe asking some what happened next questions. So what happened after you did that? Was it positive? Was it negative? Was it helpful, harmful? Did you feel good about it? These are things that we could start considering on our own campuses and communities as well.
I invite folks that are listening, if you have a question or want to learn more, Rose has kindly offered her email to folks, and the NSVRC prevention team is here for any and all questions about bystander intervention, research about bystander intervention, or sexual violence prevention in general. Please contact us at prevention@nsvrc.org.
You've been listening to NSVRC's Ask a Researcher podcast series. Thank you for joining us.